Hi, I'm Dr. Mike Horner. I'm a physiatrist that specializes in pain management. We'll be talking today about stem cell therapy. The first thing is, what is a stem cell in general? So stem cells are a parent cell or an undifferentiated cell that can then form into other tissue types in the body. So I've got a model here to better explain what is a stem cell and what that means by the term undifferentiated. So if you start with looking at this blue racquetball here, this is the parent cell or the main stem cell. And it has the ability or the capability to divide into itself and repopulate itself in order to form more of those same stem cells. Further on down the line, it also has the ability to differentiate or form into other types of cells. So it can split into itself, and then it can also split into other types of cells, which then can form things like bone or cartilage or tendon, and that's what helps to better repair or start that healing cascade going. So there are a number of different orthopedic conditions that we can use stem cell therapy for. The best research is on indications for arthritis, particularly in the knee, and you can use it in the hip joint or the shoulder joint or really any arthritic joint. The other indications would be for tendon or ligament issues or damage. And the reason why these tend to benefit well is because cartilage and tendons and ligaments don't get a good blood supply, so they don't heal real well. Unlike things like the mouth or the scalp that tend to heal a lot better because they're very vascular, they have a better blood supply. So the idea behind stem cell treatment is you take out the stem cells and then you re-inject them back into an area that otherwise may not be able to heal real well on its own, and it can start that healing cascade in order to better repopulate or regenerate that area in order to reduce pain, reduce inflammation, and improve your outcome and your function. So there's a number of different places you can find stem cells. We find them in bone and bone marrow, which is the way that we take them here in the clinic. We also find them in fat, which people use, although there's arguably better response rate to having them done out of bone marrow and processing them through that process. The other avenue that is more common is also with amniotic stem cell, which is not truly a product that has stem cells that are live or viable. Therefore, that's why we use bone marrow whenever we do our stem cell treatments here. The way we harvest or gather that is through an aspiration through your bone marrow, which comes out of your pelvic crest or your hip crest in the back side of your pelvic bone. So if we look at this spine model here, this is if someone were to lay face down. Here's the head, here's the tailbone. The back part here, which is called the iliac crest, comes here in this large bulbous area is where we actually harvest the bone marrow from. So we take a needle and we go into this bone here. Underneath this cortical layer is where you overturn a lot of your bone marrow. We then can aspirate or suck that out, in which then we process that to then re-inject back into the body. It takes approximately about an hour and a half to come in to do the whole procedure. We get you started with an IV. We monitor you with both an EKG to monitor your heart, we monitor your blood pressure and your other vital signs while we're doing this to make it as safe as possible. We have a sedation nurse there as well, that if you would like sedation, we can use that as well to help make it a more comfortable procedure. We always use a numbing medication to anesthetize the skin. And then we use an X-ray, which is called a fluoroscopy, in order to guide that into the area of the back of the crest where that bone marrow is at. We withdraw that and then we process that. The procedure itself takes about 15 minutes to actually take it out of the bone marrow itself. Then the processing time is another 15 or 20 minutes. And then depending on where we re-inject that is anywhere from 5 to 10 minutes or so to re-inject that into a joint or a tendon. Again, we either use an X-ray like a fluoroscopy machine or an ultrasound machine in order to confirm that we're in the correct area while we're doing that. After the procedure, there's a little bit of discomfort in the back area where we withdrew those cells. That's usually sore for a couple days to maybe a week. You just ice it for 15 or 20 minutes, but most people tolerate that pretty well. There may be a little bit of discomfort at the injection site that we re-inject those cells into. That may be just a day or two that people get that, but it's really a pretty well tolerated procedure. So we'll give you a rehab protocol afterward. We'll start you into therapy most of the time as well, and we'll talk you through that whole process as we go through there. The other thing we have you not do is take anti-inflammatories. They can negatively affect the stem cells, so we'll take you off of those anti-inflammatories after the procedure, and ideally a few days to a week before the procedure as well. Again, we'll address all this with you before when you're doing your procedural planning at that visit. So the results of stem cell therapy vary on the area that we end up injecting. You'll notice results almost always within the first few days to the first month. Sometimes it takes a little bit longer. And then you should have continued healing or continued progression of function and reduction of pain for 4 to 6 months after the procedure, and then continuing on for a year or years after that. Rarely do we have to re-inject the area because one injection is usually enough to have that improvement. So although stem cell therapy is used for a number of different orthopedic conditions, it's not used for everything. Certain conditions tend to lend a better outcome with stem cell therapy, such as mild to moderate arthritis, whereas severe arthritis, such as bone-on-bone arthritis, is really probably best served still with a knee replacement. There needs to be some form of tissue there for it to kind of work with in order to help that healing environment go on. Stem cells is just one, but a number of tools in a very large tool belt in order to help your orthopedic conditions.